All right, everyone, thank you so much for coming. There's an epidemic in dogs that is increasing at an alarming rate. It is now thought that 56% of all dogs are affected by this epidemic, which equals about 28 million dogs in the United States alone. This epidemic will shorten your dog's life, cause unnecessary medical problems, and decrease your pup's quality of life. But here's the thing. You can do something to help your dog avoid being a statistic. Today, we are here with the international best-selling author, holistic and integrative veterinarian, and owner of Peak Animal Health Center, Dr. Odette Suter. Thank you so much for joining us today.
Hi, well, thanks for having me. It's a pleasure. And you picked such a good subject. I'm really thrilled about it because I feel like I'm always repeating myself. So this is going to be a little bit, a little fresher.
Absolutely. Well, so for those of you that don't know, Dr. Suter, and I have notes in here, so pardon my notes, but Dr. Suter wrote this amazing book, What Your Vet Never Told You. If you haven't gotten it, you should go pick it up. And so Dr. Suter has some really amazing thoughts in there that she gets interviewed about a lot, which is why you repeat yourself all the time, because everyone wants to hear what you have to say. But today, let's jump in and talk about this epidemic. Quite simply, it's that dogs are overweight and a lot of them are struggling with obesity. So with so many dogs affected, it's kind of become, I think, a new norm that people don't quite understand what the difference is between a dog that is of correct weight, what is overweight, and what is obese, right? We've kind of desensitized ourselves to fat, and I hate to say it, but it's the truth. So can you help describe, first of all, how do you define a dog that's overweight and then also obese?
So I want to maybe start out with saying that, this is not any sort of judgment on anyone, what we're going to talk about. It's more that we just care and we want to provide information for you to help you that way, because obviously weight and quality of life are very closely connected. So this is not any sort of judgment on anyone. I know that weight can be a very sensitive subject for a lot of us. And so I just want to kind of take that out of the way and just wanted you to know that this is all about supporting you and loving you and helping you. So an overweight pet is basically an animal that's 10 to 20% above their ideal body weight. And obesity is a little higher, is basically when they're more than 20% over their ideal body weight. So it's just a bit of a staging.
So let's put that into perspective. For a dog that's 10 pounds, or between a dog that is of correct weight, what is
sorry.
That's okay.
I think my thing
feedback. No, it's okay. Sorry. So just to put that in perspective, if you have a dog that's 11 pounds and should weigh 10 pounds, they're overweight, even though it's over a pound. It's just a pound, right? And so that's kind of the mentality. And I really love what you just said. We're totally trying to be supportive and kind. Dogs depend on us as to what goes in their mouth, right? So we have to be their advocates and try to help them as much as possible. But it doesn't take a lot of excess pounds to make a dog fall into that category of being overweight. So beyond a scale, which, if you have a 50-pound dog or an 80-pound dog, most people can't just jump on a scale at home. And for some, they may be inconvenient. It may be an inconvenience to get down to the vet and to put them on a scale. How else can people determine if their dogs are of good body weight or body condition?
Yeah, so obviously I always weigh my patients, but I don't really base my evaluation on their weight. I mean, obviously, if I have a Chihuahua that weighs 50 pounds, which is, would be grossly obese, right, and probably impossible. But anyways, then it's pretty obvious. But what I usually do is I put my hands on both sides of the animal and then just, on the ribs, basically on the rib cage. And then I kind of just jiggle. And if there's a lot of jiggle and a lot of, extra tissue between the skin and the ribs, then I know that they're overweight. So just you kind of poking in and saying, oh, I can feel the ribs, doesn't mean that they're not overweight. That may be more like you just trying to avoid that. Recognizing that. But basically, if there's too much jiggle, it means that they're overweight. So there shouldn't be a lot of tissue between the skin and the ribs. They should also have a bit of a waistline, a little bit of a tucked stomach, if you're looking at them from the side. And it's also okay to see the ribs a little bit. They have the body condition scales, and if you Google that, the SAVA has a body condition scale. There are images of that, so you can kind of get a bit of a view of that. But I like to keep them somewhere between a 4 and a 5 out of 9. So we have a scale of 1, which would be severely underweight, and then a 9, which would pretty much be obese. I mean, like can't move kind of thing. Yeah. So I like to have them somewhere between a 4 and a 5. And oftentimes people will tell me, but no, my dog is fine. He's in a good weight. I don't want him to be skinnier. And I tell them, no, your dog or cat is still overweight. They may be a 5.5 or a 6, but that's excess weight that they don't have, because every pound really matters. Because it's metabolically active. Because we used to think that, or the belief was that fat was just kind of sitting there and it was good for insulation and kind of covering up organs a little bit for protection, and that was it. But what they found out with from research is that fat is very metabolically active. So it produces a lot of different hormones that have a huge impact on metabolism and other things. And I know we're going to talk about that a little bit more, but fat isn't just sitting there. And just, from my own experience, I'm postmenopausal now, and my hormones aren't quite right. And I'm working on that, but I'm starting to put on the pounds. And yeah, I'm still skinny, and people still think, oh, you're so skinny. But I put on 2 to 3 pounds, which to me, that's like a red flag. And I put it on my, in my abdominal area, which is also more metabolically active. So I know that I have a little bit of insulin resistance going on, most likely, because no matter how, I decreased the calorie intake, which did not do anything. So every little pound really counts, and it is metabolically active, and it does something. So you don't want to wait until your animal is
until it's a big problem.
Problem. So you want to keep them at a low weight from the very beginning, even as puppies, because in puppies, if they're overweight, they're much more likely to then become obese or more overweight as they get older. And I had a number here somewhere. Because when they're puppies, when they get overweight, they produce more adipocytes, which are fat cells. And I think they end up having 1.5 times more, fat cells. And so as they get older, they may actually then increase, or they may be much more prone to being overweight because they have more fat cells.
I mean, everyone thinks a roly-poly puppy is cute. And when I see people in my clients, really, I let them know the last thing you want is a roly-poly puppy. You want them to grow up first and then out. You don't want that excess weight on their developing joints and bones. You're setting them up for, cranial cruciate ligament tears and all of those other things that come with it, with cute but non-healthy puppies. So getting back to the body condition model, I think one of the things that's really great is the visual. I saw something on the internet, and I don't know if you've seen it, but it showed, I think it was a Labrador, that from the general site, most people wouldn't think that the dog was overweight. And then they overlaid the, I think 4 is the ideal on the body condition score model. And it overlaid that image on this lab. And it was so apparent how grossly overweight this animal was. So I would implore everyone to please go Google the body condition scoring model for dogs and just take a look at it, because again, you can put your hands on your dog, and I think Dr. Odette is right. You will probably say, I can feel the ribs, even though you're pushing in more than an inch to feel them, but having that visual really does help. So what are some of the other contributing factors besides, fat, as we now know, as a metabolic substance, and overweight puppies? What else contributes to weight control and being, or not having the weight control, I should say, right? Being overweight and being obese. What sets a dog up really to be overweight?
Well, for one, I mean, the most obvious is obviously overfeeding, feeding more than what they need. And unfortunately, the pet, food industry is not really helping with that, because what's on the bag is usually way too much. By law, they have, or by regulation, I don't know if it's a law, but they have to put the amounts for an animal that's intact, and most animals are not intact, and they use less calories as a result. I mean, they burn less energy. And so if you're already using that, then you're already overfeeding. So you can't really go by what is on the bag. So definitely feeding less than that. And then lifestyle obviously plays a huge role. And there definitely is a correlation between overweight and obese animals, and also their owners being kind of in the same category there. So lifestyle definitely plays a huge role. I think that generally animals do not get nearly enough exercise. They should get more exercise, because that will help with insulin resistance and all of these metabolic issues that come along with that. Obviously, if you have a dog who's very arthritic, you're not going to go out and run a marathon because that would basically be very detrimental. Not that they probably wouldn't be able to do it anyway, but I'm just saying, you have to still use common sense. But exercise, lifestyle, and then also feeding extra treats and things like that. I think people oftentimes will not include them in their daily, amount that they should
caloric intake.
So that certainly plays a role. And then hormones play a big role as well. We have a bit of an epidemic of hypothyroidism and hormone imbalances in general. So definitely looking at hormones is really important. And so for example, if I have a dog that comes to see me and the dog is overweight, and we get them on the amount of calories and the food that they should be getting, and after a month or so there's no weight loss, then obviously I will ask more questions. Well, has anyone else in the family been feeding kind of, on top? But if they don't lose weight, then I will check the hormones, because that can play a huge role in that. For example, I had a dog patient who was spayed, and she basically ballooned out after that. I mean, she was probably about 30 pounds overweight. Just from that. And when I tested her hormone levels, her thyroid levels were pretty much zero. I mean, she had zero, hardly any thyroid level. And without thyroid hormone, there's no way that they can have a normal weight. So it's really important to look at hormones, including adrenal hormones as well.
Absolutely. And I think, you said something that's really important about the back of the bag, because most people look at that and they look at it as a Bible. And one of the things that's really important is that it's just a guideline, right? And that you have to look at the dog as an individual that's in front of you, and every individual has a different caloric intake requirement for the day, right? You and I may be the same weight, the same height, and, I might have more muscle, you might be thinner, but we're going to need different calories. So it really depends on the dog in front of you. Talking about, you mentioned about dogs that are intact. So what happens when dogs get neutered or they get spayed? Can you explain to pet parents, because I don't think many people really understand how that interferes with their metabolism and how it adjusts their metabolism downward, and it affects the caloric intake that they need?
Yeah, so for example, with females, they found that estrogen actually inhibits lipogenesis, which is the production of fat cells, or accumulation of fat in the fat cells, because we all have fat cells, but some of them are just more filled with fats than others, depending on, whether an animal is overweight. So estrogen will inhibit that fat accumulation in these fat cells. So that's one thing, but it also will affect the brain in the sense that it will, estrogen limits a little bit of the appetite. So if estrogen is missing, then the satiety response is not reached as quickly. So they will just feel more hungry. And, when we remove hormones, again, I know from my own experience, you get more tired, you're lacking energy, you're kind of dragging. And what does the body want to do when you feel tired? It wants to try to get more energy, and getting more energy would be more food. And so there's that. So I think that a lot of times, when our animals look hungry, act hungry, we bleed for them, and then we give them more food, because oftentimes I hear, but he's so hungry, I feel like I'm starving him, and that is hard, definitely. I used to have an autoimmune disease, and I don't anymore, and I was on steroids for a while, but oh my God, I was starving all the time, and it was torture,
Wow.
It was. So I can relate to how the animals feel when they're constantly hungry. So there's definitely that. And also, when there is more fat accumulation in the body, it will also increase leptin, which is one of the hormones that are produced in the fatty tissue. And the higher leptin goes, well, leptin is supposed to basically attach to receptors in the hypothalamus, which is the gland in the brain, like a hormone, but like top gland in the brain. And it's supposed to basically signal the body that it had enough food. And
Right.
so when leptin levels go up, though, that hypothalamus becomes leptin resistant, meaning that it will not respond to leptin. And so then the hunger drive will never be turned off. So the animal will constantly feel hungry. So the more overweight they become, the more they stay hungry all the time.
So how would a pet parent that sees a dog that's overweight, right? And a dog that's starving over time? I mean, we all love our dogs. Sometimes we conflate love and food, right? How do they adjust for this? How do they start to slowly compensate? I mean, are there hormones for dogs? I mean, is there a way that you can help your dog kind of experience less hunger as they go through the weight loss phase? Or do you just have to look at your hungry dog and feel bad?
Yeah, well, I mean, there's a little bit of that, although I have to say that the people don't really complain all that much about their dogs being like starving when I put them on a little weight loss diet. And that may also be part of the fact that I'm also putting them on a better diet,
Right.
on a more nutritious diet, because I think one of the big problems that we have about being overweight is that we don't get the nutrients that we need. So and I include us humans and our animals in that we tend to be overfed but undernourished. And the fact is that when the body is undernourished and not getting the nutrients it needs, it will continue to look for the nutrients because that's what it needs. So it will continuously look for it. And interestingly, maybe about 10 or so years ago, I was in Paris, and food abounds there. There's bakeries, everything looks delicious. But when you look at people there, they're not that overweight. They're not nearly like, Americans are. And I think it's just because the food in Europe and other places on this planet are still more nutritious, so they get more satisfied with what they eat. Whereas I think here in the US, the food is so depleted and empty. I mean, it's just, I don't remember the numbers, but you have to eat like 30 carrots to get the same amount of nutrients that you could like 40 some years ago with one carrot.
It's a travesty. Yep.
So I think that's a big problem. And so when I get people to change the diet of their animals, they get more nutrients, and so the animal feels more satisfied. and so there's a bit less of a problem with the constant hungry.
So I'm going to go out on a limb here, but I think it's a pretty good limb for me to go out on. When you're changing a dog's diet, for the most part, you're getting them into a more species appropriate, fresher food, maybe a raw food diet that weighs, more on higher protein, higher fat, and a much, much higher level, or I should say reduced level of carbohydrates, which is really, it provides energy, but it also provides a quick source that gets deposited as fat. Is that accurate?
Yeah, definitely. I will switch them over to a species appropriate diet, because nobody can survive on like a bag of kibble long term. I mean, especially the more junk is in there, the less well they do. But yeah, definitely low carb diet, higher in fat, higher in protein, and just more nutritious overall. And then they start to feel better too, and they start to have better energy.
I think a lot of people, it's the commercialization of the pet industry, right? That they're feeding what comes in a bag out of convenience. And they think it's high carb, they don't realize the protein. And you hear a lot of mixed reviews that if it's high protein, it's going to make my dog aggressive or it's going to hurt their kidneys. It's just a lot of false information that's out on the internet. And when you start thinking about feeding them appropriately, yes, it's going to be a little bit more expensive, but what it does is it saves you the money and the expense of a dog that is sick all the time. I always say you should be investing in your dog's wellness, not their sickness. And so let's just touch upon some of the many, many, many conditions that occur when a dog is overweight or obese. Do you mind speaking to that?
Yeah, no, definitely. I mean, and the list is really long.
Yes, it is.
But basically, dogs that are overweight, 42% of those are diabetic, 40% of them have arthritis, and 61 of them can be hypothyroid. And a lot of dogs also have high blood pressure, but basically being overweight will affect their activity level. So they will have more difficulty rising and climbing stairs, and there will be excessive panting during, exercise and that sort of thing. Cardiovascular system is also majorly affected, and that also affects, some of the breeds of dogs even more, like the brachycephalic breeds, for example. If they're overweight, they really have a hard time breathing, and they already have a hard time breathing to start with. So it just makes it worse. And they can also have tracheal collapse, because the fat is kind of taking up more space and putting pressure on the trachea. Fat accumulation can also occur around the heart, and then there can also be resulting chronic congestive heart failure. So the heart is hugely affected by that. And Dr. Judy Morgan just did a talk on leptin yesterday. So if anyone wants to catch that, she talks a little bit more about the cardiovascular system on that as well. And then endocrine disorders can also cause weight related diseases, and vice versa, because the thing is that overweightness can cause disease, but disease can also cause overweightness.
Right.
So it kind of goes both ways, but arthritis, neoplasia, dogs that are overweight, they're more prone to having lymphoma and mast cell tumors, for example, dysregulation of the immune system. There's also an association to autoimmune disease, acute pancreatitis, and then all sorts of urogenital diseases. I mean, it basically covers every organ system.
All of the itises, right? And so for those of you that don't realize, anything that ends in itis is inflammation. So when you have an overweight or an obese dog, you very likely have a dog that has a high amount of inflammation in the body, which is, as far as I am concerned, kind of the basis for all disease, right?
Yeah.
So you're kind of now adding two really bad things together, and you're really decreasing your pup's quality of life. So though, your dog gives you those puppy eyes and they're begging for that treat, you really have to be the adult in the situation and say no and kind of help them out. So let's talk about some solutions now that we've identified all the problems. So we mentioned about changing the diet. How would you what type of advice would you give to pet parents that have looked at the body condition scoring model, have identified that their dog could lose some weight? How do they start this journey, which I'm sure is going to be very overwhelming for them?
Yeah, so usually what I do, obviously I switch them over to a better diet, and I try to estimate approximately what their ideal body weight should be. And that can be quite challenging. I'm usually off by several pounds. I'm too high. They still should be lower than that, but I kind of try to err on the safe side, because I don't want to decrease the amount of food to the point where they will shut down their metabolism. Because if you don't feed enough, they will go into starvation mode, and then that will turn down the thyroid levels or activity, and then as a result, they will hold on to things more. So I definitely don't want to go there. So I will usually try to estimate what their normal body weight should be, and then I will decrease that by about 10%.
Okay.
So if I have a 60-pound dog and the 60-pound dog should weigh 50 pounds, I will kind of figure out that he should probably eat for a 45-pound dog.
Right.
That amount.
And that's the interesting part, is that, again, when people look at the back of the bags, if they have a 70-pound dog, they're saying, but I'm feeding for a 70-pound dog.
Right.
Well, right. But if your dog is supposed to weigh 55 pounds, you should be feeding to a 55-pound dog, right?
Right. Yeah, definitely. You always want to compare it to ideal weight. Yeah, that's a big mistake that I see as well. Or also people saying, well, but my dog is a whatever breed and he should weigh this much, or my previous dog who was the same breed weighed this much, so why is this dog should weigh the same? And every dog is an individual, and there's no comparing one dog to another dog. You have to look at that dog to determine what the ideal weight should be. But there's also some calculation that you can do. And Dr. Dodds wrote an article about that not too long ago. But basically, if you want a dog to lose weight, you want to basically give them their resting energy requirement. So resting energy requirement is basically the calories that they need per day without exercising. So if you're giving them without moving. So if you're giving them the resting energy requirement, you're giving them less than what they would use, because they're also moving around. So basically you're putting them in a bit of a calorie restricted state. And the resting energy requirement, there's a formula, which is not that hard. It's basically the body weight in kilograms. So you take pounds divided by 2.2, and then you get kilograms. And you multiply the kilograms by 30, and then you add 70 to that. And then you get
you multiply it, right? You multiply multiply the pounds into kilograms.
Yeah.
So pounds times 2.2.
No, divided. Oh, yeah.
No, it's time. No, there's 2.2 pounds in a
divided.
kilogram.
It's divided by 2.2. Because if you have 50 kilograms, if you have 50 pounds, then you have about 25 kilograms. So it's divided by 2.
Okay.
Yeah. But anyway, so when you have the kilogram, when you figured out the kilograms, you multiply that by 30, and then you add a number 70 to that at the end.
And that's the resting energy requirement.
That's the resting energy requirement. So that's how you can calculate it as well. And then when it comes to weight loss, so I usually use my own version of it. I don't do the calculations. I just kind of eyeball it. And then I want them to start to lose a little bit of weight. So what I usually recommend to people then is to weigh them once a week. And that would be on your own home scale, or if you have a pet store nearby or a vet nearby, just go there. But make sure it's always the same scale. And about the same time of day would be ideal too. And then you just kind of keep track of that weight loss. And that's important because you don't want to go a whole month without having any weight loss or having weight gain even.
Or too much weight loss, right? Because that's a thing too.
Yeah, or too much. And so weight loss per month should be somewhere between 3 and 5%. So if you have a 5-pound dog, 50-pound dog, about 2.5 pounds a month. So weight loss doesn't have to happen fast. It just has to happen continuously at the right amount to make sure that, you know, the metabolism doesn't get thrown off.
So do you find that for a lot of people, that free feed, and I know there's a million issues wrong with free feeding dogs, but that when dogs are free fed, that there tends to be a higher parallel with them being overfed and then overweight?
Yeah, yeah, definitely, definitely. I'm not a proponent of free feeding because especially dogs they're not cows or horses. You know, their physiology is not made to be eating constantly. They're supposed to, you know, chase something down, eat it, go sleep it off. And then when they get hungry, they go chase something down again. And if they don't find anything, well, then they go back to sleep hungry. That's basically how it goes. Cats
Right.
are a little bit different that way. They tend to be a little more frequent eaters. But free feeding cats is also not ideal.
And I think, you know, one of the things that a lot of people do is that they expect, and to your point, they expect that dogs are going to eat methodically, right? I feed them at 8 a.m., I feed them at 6 p.m. And if at 6 p.m. today they don't want to eat, something isn't right. And so then they start, you know, putting excess toppers on, or they add other things to tempt the dog, or they make chicken or they make steak and they add it on just to get the dog to eat. And sometimes if you're overfeeding your dog's just telling you, I'm not hungry, right? So is it okay if your dog doesn't eat
Yeah.
one meal? Like,
Oh,
it's
yeah.
nothing to freak out about, right?
Not at all. I mean, unless you have a dog who's vomiting on an empty stomach, that might be a little different story. But yeah, if they don't eat the food that you put down within 15 to 20 minutes, take it away and then feed
And
again when the next meal comes around along. Yeah.
and fasting is, you know, there's been a lot of studies obviously being done on intermittent fasting on humans, and like you just mentioned, that's the norm for dogs. If they were out in the wild, they're not getting set meals. Do you find with dogs that are overweight that introducing some type of fasting schedule helps, or do you think that that's too excessive if they're obese, but maybe if they're not like 5 or 10 pounds over?
Well, I mean, there are people who are fasting their animals 1 day a week, and I think definitely intermittent fasting can be helpful. And intermittent fasting, for those who don't know, it's basically just fasting, just feeding within a short window of time. So feeding all the food that they will get between 4 to 8 hours, and then the rest of the day they don't get any food at all, and that would include treats. So that may work well for some dogs. Obviously, if they're on thyroid medication or something or other that they have to get, that may be different. But yeah, I'm also a proponent of doing a little fasting here and there. But again, it depends a little bit on the situation. And you know, if people want to try it, I usually recommend that they leave the house when dinner time comes along, so that they don't get harassed. Because you know, it's like it's time.
Right.
Where's my
They,
food?
right. Whoever said that dogs don't know how to tell time, they 100% do.
Yeah.
So you mentioned treats. So treats should never be, I mean, the ideal is never more than 10% of the daily caloric intake, obviously, right? And again, that accounts for the toppers. It accounts for if your dog is blessed enough, and if you are lucky enough that you have access to raw milk or fermented milk or a bone broth, like those are all calories that have to be counted. So how do you account for dogs that need to lose weight, but then you have all of these other beneficial supplements that are being added in, right? And you want to balance between the two of them, right? Because you still want to have the benefits of the goat milk for the microbiome, and the same thing with the bone broth and the joints. So how would someone account for that if they're say if all they can afford is kibble and they're adding these extra supplements? How would you tell them to compensate to reduce the caloric intake but not put the dog at like a nutrient deficit?
Yeah, that's a good question. I mean, bone broth obviously can have some calories as well, but maybe not as much because it's mostly liquids. But certainly goat milk, you would have to just account for that. But goat milk is in itself not too imbalanced, so I don't think you get into a major nutrient deficiency that way. But certainly, you know, what you mentioned before, people putting a lot of toppers on it. You know, I see a lot of people who will have kibble and then the dog doesn't want to eat and they put a lot of chicken breast on top of that, which that then causes an imbalance of the food, because you're taking a balanced food and you're just adding protein, which that will cause an imbalance, and it will, you know, change the phosphorus to calcium level. It will, yeah, so that's usually not a very good idea. Plus it also promotes you know, the dog just kind of becoming like a kid who says, yeah, I'm not hungry, when the salad is in front of their nose, but then you bring out the ice cream and they're like, oh, yeah, I could have some of that, you know. So you're basically in a sense spoiling them, and that really is more so relevant for smaller dogs. They tend to be a little bit more picky eaters, so definitely don't cater to that. You know, either they eat or they don't. You know, you eat what you get, basically.
Right,
So a
right.
little tough love. I mean,
And
you know, to some degree, obviously, if they don't eat for like 3 days, I mean, that's a different story. You know, I mean, you have to still use common sense, but do a little trying out that way.
and so if we want to feed treats to our dogs that are overweight and trying to lose weight, there's still a place for them, right?
Mhm.
I mean, we can still accommodate a little bit, but it's really where the treats are coming from, right? Are they coming from carbs? Are they coming from protein? Like, what would you recommend for a dog that's losing weight, for a pet parent that says, but I have to give a treat every time they go out to potty, otherwise they'll go inside? Like, what do you recommend they do for that situation?
Well, definitely go more for like a piece of vegetable or a berry, for example. Those would be lower in calories and would also provide a little bit of, well, not a ton of nutrients, because if they're not mashed down, they don't really absorb a whole lot of the nutrients from those, but still, it's lower calories. I also recommend to stay away from things that look like a cookie and have all sorts of weird ingredients in them. Usually I recommend just freeze dried one organ or one piece of something treat where it's just one ingredient and nothing else. And that can be like a duck heart, for example, or like just a piece of meat.
Cod skin is great.
Freeze-dried.
Yeah. Or
Yeah,
cod chips. Yeah.
yeah, things like that. Liver, you have to be a little careful. You don't want to overdo liver treats because it's very rich. Um, and it's also higher in calories because it's more fatty. And then I also recommend having a jar, an empty jar. And then every time you give a treat, put a treat into the jar as well, so that you can see how much you're actually feeding treat-wise per day.
That's
Because
brilliant,
I think a
actually.
lot of people don't know how much they're actually feeding treat-wise. You know, oh, it's just one or two. And then, well, the whole jar is full.
No,
So,
that's a brilliant idea, because you may be only giving one or two, but if your significant other is giving 5 or 6, or if you have kids that are giving some, you really can't account for it all. I love that idea. Get an empty jar, put it out there, and you pay the dog and you pay the jar.
mhm,
That's actually really brilliant. And I think it would be eye-opening for a lot of people to see how much extra their dogs are getting in a day, probably
mhm.
more than they would ever think.
Yeah, yeah. Plus, the other thing is too, dogs don't really know
So
how big the treat was. So you can just make it smaller. You know, I mean, they're not going to know. I mean,
very
they
true.
just swallow it whole. I mean, they don't really know, because it takes them just as much time to have a tiny piece, you know, or a little bit of a bigger piece. Obviously, if you're giving them a bone or something, it's different, you know, it'll take longer,
Absolutely.
but
So let's talk about exercise, because you did mention it. And I know, if you have a dog that's only 3 to 5 pounds overweight, they're going to be able to adhere to a different exercise regimen than a dog that is 15, 20, or hopefully
yeah.
not more than that pounds overweight. So let's talk first about the obese dog and then kind of go back down to the overweight dog. how do you recommend for that obese dog that already has an excess load on their joints, probably have a lot, well, we know have a lot of inflammation in the body, you know, how would you start to integrate exercise into their daily routine so that you're not putting too much stress on their heart and on all of the other organs?
Yeah. So I would say that, continue with what you're already doing, and then just start to incrementally add on to that, maybe 5 minutes every few days, or every week even. Don't go too fast, because if they are really overweight, their joints will, really suffer. And then you could also take them swimming, because that will take the load off of them, off of their legs, and they would get some exercise, a little bit of cardio that way. Obviously, weight bearing exercises are always good, because we want to strengthen the muscles of weight bearing, that are used with weight bearing exercises. Swimming is not really a replacement for that, but it can be a good replacement for just movement and burning some calories. Because, and I'm not sure that applies to the animal world as well, but in humans, they found that muscles don't need insulin to take in glucose. So with a lot of these animals who are overweight, they're insulin resistant. So basically the blood sugar is too high because the cells are not responding to insulin, and insulin is needed to get glucose into the cell, other parts of the body. But muscles apparently don't need insulin, so they are able to take the glucose out of the system. So it will decrease blood glucose, which that's a positive. So getting them to move is important. But yeah, when they're really obese, you definitely want to do some swimming or some underwater treadmill, because it kind of also takes some of that weight off. And then you obviously also have to take into consideration that they're schlepping around a few pounds extra. I don't know if you guys have ever worked with dumbbells, but everything you do with like an extra 3 pound of dumbbells, you feel it, and for a body of like 115 some pounds, 3 pounds of dumbbells is not that much,
No,
if you think
but you
about
feel
it.
it.
If you have a dog that's like 40% heavier than what it should be, that's like a huge amount of extra weight. So you definitely don't want to also take into consideration that their heart, that they will get out of breath faster, and that they may not be able to go at the pace that a healthier weight dog can go. So you have to account for that, and their respiration. And especially in the summertime, you also have to make sure they don't overheat. Especially if you have a brachycephalic one, they tend to overheat even without being overweight, but definitely an overweight dog will be more prone to that. So you have to kind of really monitor your animal and pay attention to them, and not just take them for a jog or something and hope for the best. And you can also work with a rehab vet. They can also help you with that. They can help with creating a bit of an exercise program that would be appropriate for your animal, for their condition, for their joints, and whatever else is going on with them.
And correct me if I'm wrong, but most of the, I say most in air quotes here, most of the conditions that are caused by being overweight, when the weight starts coming off, reverse. So even if you're on a prescribed medication, there is a chance that the dog could get off that medication when they are more aligned with a more appropriate body condition. Is that true?
Well, maybe dosage has to be adjusted, definitely.
I mean, have you ever seen dogs that show signs of diabetes and they're really overweight, and then they lose weight and that all kind of corrects itself?
Yeah, I mean, you definitely have to adjust the amount. I mean, definitely. Yeah. But those are a little bit more of the extreme sort of cases. But some medications, they, like, for example, thyroid hormone is based on ideal weight, the dosage. So if I have an overweight dog, I have to base it on their actual ideal weight. That's the correct dosage. for them, no matter, how heavy they are. So that doesn't really need to be adjusted then. But other medications may need to be adjusted, and that's certainly something that you would want to talk to your vet about and yeah, pay attention to. I agree.
And that's a really good point. Before you start your dog on any type of diet, go and talk to your vet, let them know what's going on, let them know what you're going to be doing, because they need to be aware, right?
Mm-hmm. Yeah.
Are there any other thoughts that you have or words of advice for the people that are listening? I don't know if anyone has asked any questions, but if there's any, because I can't see right now what's going on Facebook, but is there any other information that you can provide to pet parents that love their dogs and might need to help them lose some weight?
Yeah, so if you have an animal, and that may be kind of the opposite of weight loss, because there is actually a Facebook group that's called No, It's Not Starving, and dedicated to fit, healthy dogs. So if you have people in your life and they keep telling you that your animal is too thin and your animal is really fit and in good shape and everything, just tell them their animals are overweight, because, and don't pay too much attention to that. And if you're concerned, always ask your vet. They should be able to tell you as well. But yeah, start today and take it slowly. And if after a month your animals haven't started to lose a little bit of weight, or there's some stagnation, look at other causes and look at other things, including the microbiome, because there are microbes that can also promote weight gain or decrease the metabolic rate a little bit and hold on to things. So there are other factors. So if you have a dog who's not losing weight with what you're doing, you just need to kind of recheck and maybe go a little bit deeper and see what else might be going on.
That's awesome. Thank you so much for your time today. This is just a fascinating topic that we could talk about forever. I'm sure people, if they haven't seen it live, they'll have it in the replay, and we'll also be putting this on our YouTube channel. So hopefully we've shared some very good information with our followers, and we're helping some dogs out and cats at the same time. Thank you so much, Dr. Suter. Where can people find you?
Thanks for having me. It's OdetteSuterDVM.com is my website. So basically my first and last name, DVM.com. And I'm on Facebook, Instagram, YouTube. Yeah.
And at conferences across the country. So
yeah.
Well, and how do people sign up for your newsletter?
They can go through my website. There's a link to join the community, so they can join my newsletter that way and stay informed.
Well, thank you so much. I appreciate your time, and thank you for all your information.
Yeah, thank you so much for having me. It was a pleasure. And if anybody has any questions or needs help, we're here, right?
Absolutely. Thank you.